Happy Wednesday, everyone. Today our plan of surgery is somewhat different, but still a total body transformation. Our patient is a physician from Portland who's lost 65 pounds of weight, and she's bothered by her tummy, breasts, and her back. So the plan of surgery is, as I said, a body transformation, not like a body lift, but components of a body lift. So in the front, we'll be starting the procedure by liposuctioning her abdomen. We have a good amount of fat here. We want to utilize this fat for her buttock enhancement. So following liposuction of the front, we're going to rotate her on the operating room table. Go ahead and hug yourself. Thank you. And then we're going to be liposuctioning her lower back. We're going to take the love handles, the fat in the sacrum area and the lower back, and then use that to reshape and slightly augment her buttock. We're going to use all the fat, and again the aim is to create concavity of the lower back as we enhance the shape, the roundness, the fullness, the perkiness of the buttocks. Once that's done, I'm going to do a bra line upper body lift, remove all this excess skin. She's got slight depression here, as you can note, and we're going to utilize the fat to actually correct that so we can create contour symmetry on both sides. Once the bra line upper body lift is done, you can see the tremendous effect that this will have on her back contour. You can't pull the skin down, so you always have to pull it up, and we're going to combine that, let's get this side, with her breast lift. So as we come, you see, you're going to end up with one beautiful incision that starts on the back and come to the front and end up going into the breast lift incisions. So the incisions come together, they become the breast lift incision, and together with those incisions, we're going to perform a breast lift. We're going to do a dermal bra suspension breast lift, which is a breast lift that is super comprehensive. It's a procedure that Dr. Rubin and I described in 2005, and it's been written in a bunch of plastic surgery textbooks. But in a nutshell, it's got the anchor incision through which the breast skin is lifted up, the excess skin is removed, and then the breast tissue is molded and shaped and sutured to itself to create a breast mount here. And then that breast mount is sutured to the rib cage and to the muscle, and then you drape the skin over it. So it's not like your standard breast lift whereby you use the incision and the skin to hold the breast in place. This is anchored, and therefore it will give you a much more longer lasting result. And then we'll finish our procedures with doing a high definition tummy tuck at the end. So there you go.
Hello everybody. So we have our lovely patient here who's only 3 weeks out from a very large surgery. So we wanted to show you her results before she heads home because she's from Oregon. We did a breast lift, a dermal bra suspension breast lift. We extended the incision all the way to the back to do a bra line upper body lift, which gets rid of the excess folds and tissue from the upper back. She also has scoliosis, so she kind of had an abnormal anatomy in the back, and Dr. Agha tried to fix that by putting extra fat and tissue into the indentation here. So lots of improvement from the before.
Amazing.
And we also did liposuction of her lower back and an extended tummy tuck. So you can't see the incision when it's covered by her little thong here, but it's very thin and she's healing well. Goes all the way to the front where we did a high definition tummy tuck. She's very swollen, but she will continue to go down over the next few months.
And the anterior and lateral thigh lift too.
Oh yeah, and through the same tummy tuck incision, he does a front of thigh lift and an outer thigh lift to make it nice and smooth.
Okay. Ready? Hi everyone. Dr. Agha asked me to do a testimonial and talk about why I did this surgery and what impact it's had on me so far. So I'm a physician. I'm from Oregon, and it took me about 2 years to choose my plastic surgeon. I was looking for somebody who really focused on post-bariatric or large weight loss, who that was their primary practice, was doing that, something they did all the time, not just a couple times a year. and somebody who is creative and a perfectionist, and he's all of those things. I have a congenital deformity in my spine that's made me self-conscious about my body, and it's pretty apparent when my clothes are off. And during a stressful period in my life, I gained a lot of weight. I lost that weight. And so those things together made my body not feel like my own. I'm an athlete, I'm very active, and having all of the extra skin that I had and the sagging tissue and the very obvious deformity made me not just self-conscious, but it was logistically difficult to always be tucking my skin back into my Spanx when I was biking or skiing. So after 2 years of looking, I found Dr. Agha's website. I started following closely what he was doing. I read about all of his surgical techniques that he pioneered, and so I finally chose to go ahead with it. And he was extremely accommodating to me in doing what I felt like I needed, kind of a lot of surgery at once for me. And so I'm 3 weeks post-op now, and I'm very happy with the way my body looks. He was very creative in working to cosmetically mask some of the things that I'm not happy about, especially with my back. My breasts look amazing. All the extra skin is gone. And so, I'm still just at the beginning of the healing process, because it is a long process, but I'm really excited for what this is going to mean for me and how I'm going to feel about my body, so in the time coming forward.